Youth Alliance for Change Kenya YACK, a resilient force advocating for the rights and well-being of LGBTI communities since 2012. We are driving change, ensuring health rights and fostering inclusion. At Youth Alliance for Change Kenya, we are committed to building an unbiased HIV and mental health response. Our mission is to reduce the violation of health rights, address gender injustice, and combat the impact of HIV and TB co-infections among the LGBTI community.
Sekiwa ndani after ejaculation, what we usually encounter, most of the things in Akonga zinaweza kushiwa ziende ndani. So if it's not all that stable this side, it can stuck inside. Wengine huwa tunastolea theater, if not being pulled properly, inaweza enda kwa cervix kule ndani. So after imeapply hivi, even the pressure, the position of even the sex, you can examine. Ikiwa applied vibaya, there's a inside. So after this being inserted like this, bila amesema nini na kazi. Yeah. With precaution in the position. Yeah.
Through outreach programs and awareness campaigns, we are ensuring access to sexual reproductive health rights for over 1,980 LGBTI individuals. Our mental health interventions include counseling, peer navigation, and behavioral support for LGBTI living with HIV.
An intersex person should now take it so that let me say the intersex, I don't know how I can put it, he or she can accept that that's how the person was created, because it's very difficult for somebody to accept this is me.
Yeah, for an intersex person out there, in order to accept themselves, they need to, share. They always say a problem shared is a problem half solved.
Yes.
If you want to get assistance, you have to be able to share. Share with someone, within your circle. It might be a friend, it might be a counselor, it might be a relative, anybody whom you feel like you will feel better if you share your condition intersex. Once you share, they will create that suitable environment that will welcome you to feel comfortable and confidentiality. Once you share, they do not need to share again with anybody, so that you can feel ujasema kitu ambacho kitatangazwa na huyo mtu.
Yes.
And again, you need to be in groups. Seek groups whereby intersex persons come together, like peer groups. Of course, there are peer groups for intersex persons, people with cancer, people infected with HIV. They have different kind of groups. So once you are a member of this group, you get psychoeducation. People are empowered on how to cope up as an intersex person, how to manage, how to live with people, how to fully accept yourself as an intersex person bila makasiriko. You can just decide to be an angry person.
Yeah.
But once you fully understand, you come to terms with your condition intersex, you will accept yourself and live like any other person. So social support is really key.
We train healthcare providers to deliver stigma-free, inclusive services, which also facilitates treatment, surveillance, and access to viral load monitoring.
My name is Wilson Otieno, I'm a public health officer.
Welcome, Mr. Wilson Otieno. What are some of the lessons you have learned from today's session?
Yeah, from today's session, I've learned about how the LGBTQ person should be handled. One of the key things is confidentiality. Yeah.
All right, and how do you think the lessons you've learned today can impact on good service delivery to the LGBTQ?
Yeah, it can really impact a lot in service delivery, because one of the key things is that health care is very important for every person, especially the LGBTQ people. We have to handle them holistically.
Yes.
No matter your gender or your sexual orientation, your health is very important. So we have to handle you holistically, no no matter your sexual orientation.
Yeah, you have to do the holistic approach in handling the LGBTQ.
Yes.
And Mr. Willis, what message do you have to your fellow public health officers somewhere in Migori, Siaya, or Kisumu County regarding the key population from the lessons you've learned today?
Yeah, my message is that they have to handle the LGBTQ persons with a lot of care. All the necessary care as healthcare providers, the necessary care that should be given to anybody, no matter your sexual orientation, should be in line with the guidelines with healthcare.
All right, Mr. Willis, maybe the last two questions.
Yes.
What, from your observation from today's training, you came in, you are introduced a brief background to organization. What areas do you think, what recommendation can you make to our organization? Like, what are some of the areas you feel we need to improve on as an organization moving forward to achieve our objectives best?
Okay, one of the objective I think we should improve on.
Yes.
One of them is that we should cascade this to more areas. Yeah, because it is true. We have gays, they are there. So we can't hide that fact. It's a fact. I'm healthcare provider and I know it. Yeah. So we have to speak fact, but confidentiality is very important, and all the levels regarding healthcare are also very important.
Thank you, Mr. Willis, for the good response. And what's your final take or message to the donor? What can you say to the donor who funds this organization to do these things?
Okay, for me, I want to thank the donor, the rest of the team for organizing this great event, and I believe we will work together in other areas so that we ensure that everything is on. Yeah, thank you.
Thank you, Mr. Willis. Have a nice time.
To create a safe environment, we empower law enforcement and paralegals to address stigma and protect LGBTI individuals from discrimination and violence.
And on the parameters on how to express or identify yourself sexually. Are we together? And that's why they have the freedom of expressing themselves. So legally, if you look at the laws of the land that govern the land, are we together? You cannot crucify them, you cannot prosecute them at any court of that of law. Are we together? But if you look at spiritually, are we together? You feel that this is not what was created. Because God said, I created the male and female. You should be going by that. And if you look at within the society standards or norms, you will feel that these people do not feel within the standards of the society. Are we together? Another thing that
Through our safe spaces and support networks, we are reducing social isolation and ensuring LGBT individuals receive the care they deserve.
Can we get HIV through sharing of plates? Hatunapata mimi niko na HIV nimekula na sani, if I give you the plate you don't eat because you feel you'll be infected by it. Through sharing clothes. Sina hata nguo nataka kuenda mahali and I feel this nguo kanitosha mimi. So when I come to you ask for nisaidie nguo and you know I'm HIV positive, because like you know I'll be infected with the virus. Is it possible transmitting through sharing of nguo? It is not possible. Something that we left out.
Hello, I'm Collins Yoko Odiambo. I'm one of the developers who developed telehealth. So telehealth practically is a platform that enables the LGBTQ community and the sexual workers to access services they wouldn't normally access at the hospitals. Now the basics of telehealth, that's why telehealth was designed, was the aspect of reaching out to those who can't be reached, and also the privacy around it. So in telehealth, they are allowed to access services, request for any service, be it condom, lubrication, or any other service. Let's say they need a medical practitioner to reach them out. So they are able to reach out by the system, and the system gives that back to the office, and the office can allocate or can reach out to primarily a medical practitioner to reach out to them. So the telehealth was bridging that gap that has been there. Now, as a community in Kenya, being in LGBTQ and sexual workers, they are normally braced with uncertainty with how people greet them, how people react to them, because it's not something that the Kenyan culture accepts. So telehealth was built to bridge that gap and to assist them get those services. So telehealth has been available for 6 to 7 months, and it has been working. Practically on the dashboard, we've reached like 137 clients, some reaching just out for let's say condoms, which has been the major issue, and lubricants, but also the aspects of mental health part of it. So we've had to transition others from being mental health from the platform to mental health practitioners and back to the platform. What we value most on telehealth is privacy and giving the users the atmosphere they need whenever dealing on matters of health. Also, mental health is looking onto integrating more of educational content on the platform, and that is one of the things that we are envisioning. So mental health has some functionality that's envisioning, and also going the mobile view, because most people are accessible to mobile, and currently it's viewable via web-based. So if we can have more funds to generate so that we can develop it on a mobile view and also make it USSD. So in USSD we mean that it can be accessed via an SMS platform. Those are the functionalities we are envying to incorporate within the system. Thank you.
Real lives are being transformed. Listen to the stories of resilience, empowerment, and hope.
We all know that today was World AIDS Day being celebrated in 2024. It was yesterday, but we observed it today. So as queer people, we all know what this means to us, right? So would someone briefly tell us what happened and how you felt about the day and everything that took place from your eyes?
We had a successful day today celebrating World AIDS Day, and we are appreciative to YACK and our sponsors, Gili, for enabling us to participate meaningfully in this day, partake in the march and be vibrant and present ourselves. You know, like as queer people, we get to enjoy these activities, especially the county activities, where we are allowed to be ourselves in our identities, in our orientation, and be proud and be accepted. Thank you very much.
Thank you.
Together, we can build a future where everyone has access to healthcare, justice, and dignity. Join us in making a difference.